Everyone, once again, welcome to my Oet channel. Today, we will see one of the role play which appeared on the exam. The date is 10 September 2022. So, this scenario is happening in emergency department, and I will read you the settings for you. You see a 65-year-old patient who has broken his or her right shoulder. There is a proximal humerus fracture due to a fall at home, and she came to the emergency department complaining of pain, and you are getting some information from the patient and you are giving some advices and information. So here he or she has been given a sling to wear and is now ready for discharge. That means it's already happened, it's finished already. You are giving information about aftercare and healing process. Okay, so what I want to explain you here first means this is a non-case scenario, same like our non-case letter. Nowadays we have non-case role play also. Most of the students, they are unaware about this matter, and this is updation happen. So how we can find out whether this is a non-case or not, non-scenario or not? They have given, he or she has been given a sling, it's already given to wear and is now ready for discharge. So already you know the patient, you already started to talk, and even you gave the sling and ready for discharge. Now you are talking about aftercare at home. So this is the first thing you have to keep it in your mind, whether it is a non-scenario or a non-scenario. Now we can go to the task. The first task is give reason for seeing patient, information on aftercare and healing, and find out how patient is feeling about going home. Still patient is in emergency department. So what you have to do during 3 minute preparation time, you have to ask patient's name. How may I address you during the role play? Example, patient's name is Maria. Then how we can start? Good morning, Maria. How are you feeling now? That's enough. No need for your self introduction because you are the one given the slings and you are the one taking care currently. Then you have to tell that actually I came here for giving some informations on aftercare and healing process about your current situation or for your wound. Is it okay to discuss with you? That patient is telling that, okay, sister, I am fine. Actually, it's okay, fine. You can inform me regarding the aftercare. Find out how patient is feeling about going home. Then we can ask, may I know how you are feeling about going home now? Then give information about care of shoulder. So that means you are asked the feelings. Then patient may told you that it's okay, fine, sister. I'm happy to go home and I can take care by myself at the home. Then we can tell that the next task is that give information about care of shoulder, like immobilization of arm with sling for 3 weeks, painkillers and analgesia, maintaining mobility of elbow, wrist and fingers, etc., and find out if patient is in any pain. So we can tell that, Miss Maria, I will give you the information regarding your shoulder care. Here, you should not tell that you have to immobilize your arm with sling or something. You need to, you have to. These things and all you have to avoid. How we can present? Please immobilize your arm with the sling which I have provided to you for 3 weeks. And it's essential for you to have any painkillers or analgesia as per your doctor's prescription. Also, it is essential for you to maintain your mobility of elbow, wrist and fingers to prevent further complications. Are you follow with me? Are you follow or are you getting my point, or is it clear? Like that we can ask. So here you have to inform like that it is beneficial for you to, it is essential for you to, it is important for you to, or please. So these things and all you can remember from your letter recommendation, the same format. Then you can ask, may I know, Miss Maria, are you in any pain? Then, then the patient is telling that, yes, sister, I am still on pain, but it is bearable one. Then, if the patient is telling that yes, it is very severe or I can't bear the pain or something, means there will be some more information. But what is your next task? Give further advice on care of shoulder. Example, pain relief regularly 3 to 4 days, then as required. Application of ice pack 15 minutes every few hours. Extra support when sleeping. That means patient told you that there is pain. So we can tell that No need to worry, Miss Maria. This is quite normal for everyone, those who have injury in on shoulder. And at your home, I would like to tell you some pain relief measures, like regularly 3 to 4 days you can have your medication as per your doctor's instruction. Thereafter, as required, whenever you have pain, you can have the tablet. Moreover, you can apply ice pack 15 minutes every few hours. Also, you can have extra support when you are sleeping with additional pillows. How does that sound? Like that, we can ask. Then, find out about patient's job. If retired or working, type of work, any strenuous activities, something like that. So, of course, the patient is 65 years old. So, of course, we can hope that patient is retired. Then we can ask that, if you don't mind, may I ask you, what is your job? Are you working or are you a retired person? Because I would like to know about your activities at home. Then maybe patient is telling that, no, sister, I am retired person and I am in only in home, but occasionally I am working in my garden. Then we can tell that I am happy to know that you are in a retirement life and you don't have any strenuous work in your home. Then the next stage is give likely stages for recovery. That means patient have asked something. Then we can ask, do you have any concern? Then maybe she told that, what is the recovery period, sister? I would like to know that how long it will take for my complete recovery. Then we can tell that, Miss Maria, I can truly understand your concern. Actually, your injury, maybe it will take the healing process. It will take the healing process of fracture is 6 to 8 weeks. You can resume driving after 2 to 3 months, and your full range of motion or the strength can be regained after 3 to 4 months. So this is the recovery stage. I hope it's clear for you. Then patient may tell that, yes, it's clear for me. Then we can tell that, Miss Maria, of not, I would like to give you some advices. um, Really, I'm sorry to tell you that please away from driving before driving until 3 weeks. And I would like to tell you that if you resume driving before 2 to 3 months, there is a chance of further injury, or there may be a longer recovery time period. So I'm strongly recommending you to avoid driving for 2 to 3 months. Are you okay with that? You can ask. The patient is telling that, yes, of course, I can wait for the time period. Then we can tell that also you are in restricted movement. So inadequate control of vehicle. So that means you have already in a restricted movement, and if you are go for any driving or anything, there is a chance of risk or any complications. So before that, please arrange your transportation of anything. That is the meaning. Okay. Then outline next step. So what is the next step? Then we can tell that, I hope I have clarified all your doubt, and let me explain you what is the next process. You will be having a follow-up appointment in 2 weeks, and also the physiotherapy will be initiated in 6 weeks. So you will be in an completely in a resting period. In between, you can have the range of motion exercises by the physiotherapist, and in 2 weeks you can have the appointment with your GP or in the hospital, so that they can have the review for your improvement. Is it okay for you? Then patient is telling that, yes, it's okay, sister, I can come for the review, and of course I can follow up the physiotherapy sections. Then we can tell that, thank you so much, Maria, for accepting all my advices. I hope I have clarified all your doubts. If you have any doubts, please call me. I will come and assist you. And if you don't have any other clarifications, may I proceed with the procedure, with the discharge procedure, because you are here for discussing with the discharge process. So you can tell, like, because still situation is in emergency department, so you can ask, you can tell that if you have any problem, you can just call me. And I hope for now everything it is clear. So may I proceed with the discharge process? Then patient telling that, sister, I don't have any other concern, you can proceed. We can wind up with thanksgiving. That's only the role play. And here, this is an emergency department, so you have to be take care while giving the suggestions, because it should be in a polite manner and should be like in a reassurance manner. And of course, the warn, if the phrase, if it is warn means, you should not tell that you should do, you have to do, not like that. I'm sorry to tell you that if you didn't follow my instruction, there may be the chance for getting complication. So in that way, you have to present. So I hope this role play is clear for you, and we will see with another one informative video. Until then, bye. Take care.